First time you're exposed to a disaster scenario, we don't know what you may do. Some people may panic, some people may do the wrong thing.
In the old days, we'd watch, we'd see, and then we'd do, and then you're on your own. And that is not the best way to ensure that we're doing the best for our patients.
So before someone's placed in a scenario where they'd have to take care of a patient with these life-altering injuries, let's implant folks who have a medical background, but not necessarily the trauma training background that we need, and get them spun up on those scenarios.
Simulation offers the opportunity to get hands-on training and tactical training where you're actually applying the knowledge that you know in an environment that's very similar to what you would encounter in the hospital.
Everybody knows CPR training where a mannequin, maybe an Annie or a Chris or something like that, and you're doing chest compressions and breathing into this relatively low fidelity, not very lifelike mannequin.
The highest fidelity mannequins have animatronics, physiologic engines, meaning if I give this mannequin a medication, it will respond as though I've given it the right medication. It can actually detect what I've given it.
Simulation training has been demonstrated with scientific rigor to reduce hospital-based errors, which in turn saves lives.
We're a program that takes care of medical modeling and simulation for the Air Force. We have 52 contracts, and those are located at 30 different locations, and we also support 90 medical treatment facility programs.
142 over 73? 142, 73, ma'am.
For medical simulation, you have AFMMAST, AFMMAST, the Army CSC, you have the DEMSO office with the DHA, but simulation started with aviation, so the aviation world is huge in simulation.
The more realistic you can make your training, the better the learning is going to be, the more they remember out of it.
We're finding that many of these newer technologies keep them engaged for longer and actually have the promise of helping them retain information for longer.
Medical simulation is the way of the future, and it's incumbent upon us to make sure that we keep up with that technology to give the best quality training for our students.